This is Andrew Richey. I'm the co-producer of Code Black, and you can learn more about it at codeblackmovie.com.
21-year-old male, multiple gunshot wounds to left and right chest, is that correct?
If you're an outsider, this looks like total chaos. But I see unity in that chaos. There's a team here coming together to save someone's life. We're starting our senior year as ER doctors. I had heard this was a very difficult place to train.
It's one of the most challenging places to work.
The gap between thinking and acting is minimal. There is so little tolerance for mistakes.
This isn't very good. What happened? During Code Black, it feels like the place is gonna blow up at the seams. I knew being a doctor anywhere else was not gonna cut it.
So Code Black is it's really a film that follows several residents as they navigate the LA County ER. And it's a little bit of a coming-of-age tale as they show up with all their ideals and the way they're going to take on the world. And they're sort of faced with this crippling healthcare system that we all sort of live in today. And it's whether or not they can sort of continue on with those ideals and continue their dreams forward.
I knew that my life had to mean something.
My dad was diagnosed with Alzheimer's. I wanted to have the ability to help somebody who needed it.
It scares the hell out of you, and it makes you have to work hard, and there's no excuse.
Part of what we're trying to figure out is who we are.
The people in the emergency room were just different.
I really don't work out that much.
And it really starts as a crazy ride with, you know, it's not your typical doctor. It's your cigarette-smoking, adrenaline junkie, cowboy doctor fighting to save people's lives, pumping hearts, trying to get everything going. And, you know, it sort of breaks off into a little bit quieter discussion, too, as well, to really get into some of the things that are affecting the healthcare, coming from the eyes of these residents, just getting into it with all their ideals and trying to tackle that.
You're seeing people usually in the worst day of their life, helping them cope with that moment. I don't expect that to ever get easy.
It really is just about doing the right thing for somebody. When we started this, it seemed so simple. We were gonna help people, but as a doctor, the system is sometimes bigger than you.
So that's a really important subject. I mean, it's pretty far-reaching too. So what do you hope to accomplish by having this movie come out? What is in your best case scenario?
You know, we don't kid ourselves. There's people tons smarter than us out there proposing answers and solutions. And so with the film, we really don't try to do that. Even the doctors involved, you know, the director, Ryan McGarry, is a doctor. And we're not putting the answers out there. We don't have them. But honestly, politicians, you know, take a one-liner from their speech writers and turn into this pithy, ridiculous discussion where all the faces are pulled out of it. And so our goal is really to put the human back into this discussion, because when you politicize it and you strip it down to just money and dollars, it's not real. You know, we spend so much time in that ER, and the doctors and the nurses and the healthcare providers who spend their days fighting this battle on America's front lines are real people who are affected by policies. And further than that, the people sitting in the waiting room waiting 25, 36 hours, working class Americans.
It becomes this bucket of paperwork of saving somebody's life.
You work so hard, and all it takes is one thing to kind of topple it all down.
You have to ask yourself, how do I protect the ideals I came here for?
The crushing regulations on hospitals, they're tying your hands.
People that need help are turned away.
It's heartbreaking, soul-crushing, actually.
People leave because they can't wait anymore?
The doctors of this hospital believe we can do better.
Someone is suffering. What are you gonna do?
It's about these moments that are big, that are larger than life.
We're in a crisis situation.
I think those are pretty high stakes.
It's a team fighting to save someone's life.
How hard was it to film during the trauma that was going on in the emergency room?
It was a challenge, and again, we were lucky to have a team of residents and medical students around us that could tell us what was going on, and we had a doctor leading it so that we knew where it was okay, where we'd be in the way, what was safe, what we should be covering. But one of the biggest challenges was we didn't really feel that, and we still don't feel that an ER is a place for cameras, you know, but a lot of people at LA County ER and the filmmakers, we felt that is an important enough discussion to try to help save and begin to repair America's safety net, that we should do it. But we try to be very careful when doing that, that we never brought those cameras out and put it in people's faces until they had given us permission, until we described the project that we were doing, saying that we're trying to repair this a little bit. Can you get behind that?